Novel. That thing that you're supposed to be reading for Mr. Ward, Ms. Zuccaro, or whoever else you have for English. You know, the little thing with the paperback pages in it tells a story, such as I Will Always Write Back. But we're hearing the use novel more prevalent today with the coronavirus, because the coronavirus is a novel disease, something that has not been familiar with humans before. And that is the reason why it has been so impactful in our world, and thus a pandemic. Our guest today is Dr. Steve Cawood, a emergency room doctor for over 26 years, and he is currently the head of the emergency room at Norton's Hospital. Let's look and see what Dr. Cawood has to say about the coronavirus and sociology.
And now, Sociology Today, with your host, Chad Wagner.
All right, guys, we are here with Dr. Cawood. Thank you for joining with us today.
Thank you. Thanks for having me.
Doc, what is the situation that we're looking at in Louisville? We hear all these, epicenters like New York, New Orleans, Detroit. What is Louisville looking like right now?
Well, cases are definitely kind of continuing to rise, but certainly not as quick as in some states. I think the last, I don't know what day it is now, I just worked last night, but I think as of April 1st, at least, we had tested about 7,500 people in the state of Kentucky, and about 600 of those are positives, about a 8% positive rate. Where I work at Norton Healthcare, we've done about 2,000 of those tests, and we're seeing about a similar positive rate. So it certainly is community-wide, but we are certainly not as severe as some of the other hotspots in the country.
Now, with the governor announcing yesterday that he's going to make the fairgrounds, I believe, a temporary hospital area, I mean, are you projecting that we're, from your experience, what you're seeing at Norton's, are you seeing like a growth that's starting to be concerning?
Yeah, I think what everyone's trying to do is learn from what's going on in other states. So initially out in Washington with Seattle, and now obviously all the things we're hearing in New Orleans and New York right now, we're just trying to get that information and working with the governor and the health departments, and using Army Corps of Engineers and Air National Guard and people like that to try to figure out what can we do to set things up in case it gets to that surge that we need it. We're not there yet, but we don't want to wait until the time is there that we need it and we don't have it set up. So what we're seeing is that a lot of people that do get really sick from this, the ones that do, it can take quite a while to convalesce. And so then the problem is if they're just in the hospital, not necessarily needing acute care, but can't really go home, there's nowhere really for them to go. And so setting up places like that at the fairgrounds would be a place where you could house or offload people once they've gotten out of the ICU standpoint in the hospitals, until they completely get well enough to go home. So I think it's a great contingency plan that the state's looking at doing, and we're just modeling what other states have done.
Now, we keep hearing a lot of things about ventilators. Now, are you seeing that there is a need here? Are you seeing patients needing it here in Louisville? And what is that process like for, someone going through COVID needing a ventilator?
Right. So it's, certainly we're needing them. I just placed a patient on one probably 4 or 5 hours ago that is at our facility. Patients being put on ventilators is something that's done for myriad of problems even prior to COVID. So hospitals have ventilators. We have intensive care units that are set up for patients that need that level of care. The concern is if with COVID on top of the normal demand that's there just from people with having strokes and heart attacks, that if we had a large volume increase, would there be enough capacity? So that's one of the things that a lot of hospitals have done is they've stopped doing elective surgeries so that there's less people that are needing the intensive care areas, so that we have increased capacity even just in our own facilities. But from the ventilator standpoint itself, Louisville is pretty fortunate, and healthcare is a large industry here. We have, 3 major kind of healthcare systems here. And so in the city of Louisville, as long as we don't get a huge surge like is something in New York, yeah, we have an adequate supply of ventilators. I think places more rural in the state, though, probably are not in that situation. And so as the tertiary care centers out in the state get sick patients and have to transfer them to the Lexingtons and the Louisvilles of the world, that will certainly tax our capacity. But at the end of the day, no one is really prepared for something like as large of what some of the large cities across the world are going through. But for what's projected, for what the state of Kentucky is probably going to go through, as long as we keep doing a good job with following Governor Beshear's recommendations, we should be okay.
So, Governor Beshear's been saying, like, hey, stay at home and things like this. Well, what does a person do when they feel like they have like a little twinge in their sore throat, they've had a cough, maybe a slight fever, so they're showing maybe some kind of symptoms, but we're also, trying to say don't go to the hospital at the same time. So, and they're worried about, well, if I stay at home, am I going to get other family members sick if this is highly contagious? So without our testing and stuff, what should somebody do when they are feeling these early strains of symptoms?
Well, I think that what we're trying to get the message out is if everyone would just kind of assume that they have it.
Okay.
And then treat yourself the same. So the treatment's the same if you're scared you might have it versus if you do have it. And the main thing is using good respiratory and hand hygiene. So if you're sneezing or you're coughing, make sure it's covered up and it's not spewing out particles into the air. Making sure you're keeping your hands washed down and surfaces clean. So the main thing is just not trying to spread it from that standpoint. But the key with all of this is why you keep hearing the terms, social distancing or trying to stay 6 feet away, is that it's mainly felt to be droplet spread, and droplets in general don't extend out past a 6 feet distance. And so if you keep away from people, just being in a room across the room with someone who has it, you're not necessarily going to get it. But the key is if everyone just treats themselves as if they have the coronavirus, do the same thing. Stay at home. Don't go out if you don't absolutely need to. If you have the sniffles, maybe it's allergies, maybe it's the flu, maybe it's COVID. But the treatment is basically the same as stay at home, use over-the-counter medications that you probably have in your medicine cabinet already for congestion or cough or sore throat. The only times you really need to be coming to the hospital is if you're short of breath to the point to where not just when you walk across the room, but when you're sitting still, you're labored breathing, you're panting, you're sweating because you're breathing so heavy, you're getting chest pressure that is getting to the point where it feels like your chest is getting restricted. That's when you should go to the hospital, and don't be afraid to go to the hospital. The hospitals are set up to handle people that are coming in to try to keep them separated from the people that are having other issues that aren't COVID related. But what the message we're trying to get out is, don't just go to the hospital because you got a runny nose, sore throat, cough, and you're just worried you may have it, because we're probably going to tell you, yeah, you do have it. Go home and stay away from others.
Oh, well. Now, you just mentioned social distancing. Like 2 weeks ago, we saw thousands of people flock to Florida. College students flock to Florida. If you look at some young people's Snapchats, you're seeing, people really not doing the social distancing and things like that. If you go to a park, you see large groups of people hanging out together. What's your response? What's your response to that kind of thing?
Yeah, that's hard. And I have a freshman in college. He was a senior at Trinity last year, and we've had a lot of good conversations about that. He is feeling very fortunate that he had his senior spring break last year, and is thankful that he is in the position this year of having to kind of make that awkward decision of going down there and doing things that he knows dad and mom aren't telling him to do. But I think the thing that I would tell kids is, and I've seen the interviews of the spring breakers down at the beach and the kind of the callousness of it, but, think of Christmas dinner, think of Thanksgiving dinner, something this fall, just, Christmas coming up, and everybody sitting down to family dinner, and grandma or grandpa isn't there because they passed away with the COVID illness this spring or this summer because they caught it from people that spread it needlessly. Because they just wanted to have a good time. So I think if you make it personal and look at it that way, you do see your role in all of this. And, there's plenty of times to have fun, play hard, work hard. There's appropriate times for it. This is just not one of those times to go out and think about yourself.
So, you have guys and gals that are thinking about themselves because maybe one of the reasons they're like, well, it doesn't really impact me. I don't feel like I've got it. And there's more people that die from the flu every year anyway. So why are we making such a big deal about this one?
Yeah. And I think that's one of the misconceptions. And I think all of us, when we heard about in the medical community, when we heard about this going on in China, that was, kind of our thoughts as well initially, was just thinking, wow, we have more people die of the flu of that already. So it's not that bad. But the key to understanding this is it's called a novel virus, meaning that this is the first time this virus has been entered into the human race or the population, the species of humans. And when that happens, no one has immunity to it. So that means everyone is likely going to get an illness from this one way or the other if exposed. Now, some people may have relatively minimal symptoms, but because it's a new virus, none of our immune systems have seen it before. So we have no antibodies in our system that recognize it and ward it off to keep it from minimal symptoms at bay. Whereas the flu has been around for years. We have vaccines, so a lot of people don't get it because they've been vaccinated. A lot of people don't get it because they've had it before, and so their immune system recognizes it. But with this, nobody's immune system recognizes it because it's never been around before in humans. And so that's why the contagiousness of it is so high, because there's just no part of the population has immunity to it. And so whether you're old, whether you're young, whether you're rich, whether you're poor, whether you go to private school or public school, we're all susceptible to it in the exact same way. And so that's what makes this one so different, in why social distancing and trying to prevent the spread of it is so important.
So we do have guys staying home. They're doing like what they're supposed to do. We have a lot of families that they're, locking themselves down. They're doing the social distancing and things like this. But, as humans, we're a very social group. I mean, like from the earliest days of humanity, we came together in clans and we depended on each other. And now we're saying you can't be together and you have to separate. So I would think emotionally and mentally, we're going to see some results from this because, we're a group that's supposed to be together. Now we're saying stay apart. What are you seeing on that kind of thing, the emotional and mental welfare?
Yeah, well, I think, our brains are certainly, from a human standpoint, that is what separates us from a lot of the, evolutionary chain. Our frontal lobes have developed to have mental capacity that both helps and hurts this. So, all kinds of creatures down to bugs and insects and fireflies and everything are very social in nature and how they do things. But what makes it different for us is our frontal lobe gives us the mental capacity to digest information and to make adjustments to that. And so I think the key is we have to be mentally tough and smart about this. We have to use our brain that we do have to say, wow, we can dampen the progress of this by doing the right things. So yes, we are very social, and that's one of the hard things about this pandemic, is that it's so unknown because it is a new virus. We don't necessarily know the who, when, how, why of this virus, and that's very emotionally taxing. So it does affect us psychologically, it affects us mentally. It affects us emotionally. It's scary. It's scary for everyone, for those taking care of people, but also for those people at home that don't know what to do either. And that is going to be a challenge from a social standpoint. But as we're doing right here, communicating via Microsoft Teams, I think we do in this generation, and certainly the youth are very social media heavy, and it's the perfect form to maintain your social connections without physically being close to somebody to pass the virus.
You've shared that it was scary. You're in the front lines. We're now seeing in the news, doctors are nurses are being impacted it by getting, catching COVID. Emotionally, with you being in the front lines, seeing what you're seeing, dealing with patients, as well as living in a very scary time, how are doctors and nurses emotionally handling themselves with this situation?
Yeah, and I think that's certainly, one of the hard things is it's people have asked, how would you describe the mental state? And I think the word drained is probably the thing that comes to mind the most. And that, you get ready, you go into work, and you have your angst and your catecholamines released, or kind of charged to go in and kind of go in to take care of people during your shift. And so you're all kind of amped up, and then after hours of doing that, you go home and you're just kind of left to the point to where you're just drained, you're kind of wiped out. And then you get up and you do it again the next day. And it's the repetitiveness of it that I think over time, without having a chance to kind of digest what's going on, or to mentally decompress, I think that's over a period of time, that draining effect is what's so challenging. And certainly as a cross-country coach that you have been as well, I think one of the definitions that we try to tell everybody, that this is a marathon, and it's not a sprint. And so you can't really go in guns blazing with everything you got at the outset. You have to realize that this is going to be a long, ongoing process, and to take things methodically, have routines to help maintain your mental, your kind of mental sanity, if you will. And part of that is physical as well as mental. So on the physical side, if you're not, getting good rest, if you're not having a good diet, if you're not doing exercise or doing things to keep you mentally okay, then that's going to affect the mental side. And the same thing mentally, if you're not doing mentally well, and you're not decompressing, and you're not finding ways to get in a good place, then that's going to impact your immune system, and then you're going to be just more susceptible to getting infections as well.
So mentally, what should people do if you are locked in home? What are some of the things that you would suggest to do to give yourself a mental boost? Right.
And I think one of the things that we've seen so much, just the outpouring that we have seen support as frontline workers, whether it's, and this isn't just about the doctors and the nurses that are there at the hospital taking care of people. This is the housekeeping that's keeping our environment clean. It's the EMS people that are, having to transport patients back and forth. It's the police and security people that are, helping with crowd control and keeping, people organized. That it's really, everyone that's involved with this. And I think the key is that, people are looking to find ways to help. And I think that's the key to this. It's the key to most with happiness in life, is to find purpose, and to find a way that you can help in some way, whatever that way is, whether it's, of your neighbor helping, it's spring and things are blooming up and there's, branches and twigs that are down, help clean up people's yards, or people are making masks. We've got a whole stack of cards 2 days ago when I was at work from a dance team over in Southern Indiana that couldn't have their dance practices because of social distancing. And so they all kind of just made cards and sent them in, and we got a box of cards. But I think when people find a way that they can connect with a purpose or a way to be a part of it, that helps the mental side so much, because it's uplifting. And that would be what I would recommend.
So finding a way to impact your neighbors without breaking that social distance kind of rules.
Yeah. Helping neighbors, helping, family members, we've, my wife's out right now going and getting some, the weekly groceries for her elderly mother right now. Find a way to help your grandparents if you need to, do things that help the people that are on the front lines. And the main thing is do your part in just social distancing. If you're not being a part of it, kind of model that good behavior that we're all asking. And that's, if you're not helping pass it on, you know, that's the number one thing any of us could really ask for on the front line is just if you could just it's going to take us all to get through this, and we're all going to have to work together. And the biggest part of any one individual's thing is to not pass it to the next person.
So the quickest way for us to get through this as a society is for all of us simply to do our part. And as soon as we all do our part, we should be able to see that decline, correct?
Yeah. And then that's why, I'm sure everyone at this point, it's funny how the vernacular has changed, and we're using words like social distancing and flattening the curve and COVID and things that we are, PPE, protective equipment, that we didn't typically use, but that's really a part of it is that social distancing. If we can prevent the spread of it, that'll be the quickest way that we can flatten the curve. So again, the virus is new. It's new to our immune systems. 80% are, mildly symptomatic, and there's 25% that have no symptoms at all. And so a lot of people may get exposed to it. You'll then have immunity to it, hopefully, for the next time around, and will help limit the spread by keeping distance.
Well, Doc, thank you for being a part of this discussion. You stay safe, of course, and thank you for all the stuff that you're doing to keep us safe.
Well, absolutely. It's a challenge for all of us. Believe me, having kids myself, I understand that it's hard on them too. It's hard to be separated from your friends. Peers are a lot of times the most important thing to teenagers, and when you're not being able to have access to them in the normal ways, that's a struggle. And even though most kids will say, I don't like school, most of them really like school, and they like the social interaction from it. And so it is a challenge. And I think, parents have to take time to be sympathetic to that too, that the kids are going through a lot, and don't be afraid to talk to them about it.
Well, thank you, Doc. And we'll see you here hopefully soon.
All right.
So there you have it, fellas. We got to do our part, washing those hands, staying socially distant, and doing the things, though, to keep our minds and our hearts and our emotions healthy at the same time, too. So make sure you're getting some activities. As always, missing you, fellas. Remain awesome. Be nice. Stay safe. And now I'm seeing you online. So there's that.
Cause I saw a tiger, now I understand. Well, I saw a tiger, the tiger saw a man.
Sociology Today was filmed in front of no studio audience because, well, we are self-quarantined.